Hi, my name's Brianna,
And I'm Heather.
and we did our town hall on the upper respiratory system. Starting off, we have laryngitis. It is the inflammation of the larynx with diminished voice or hoarseness that may occur if the infection of pharyngitis progresses to the larynx. It may be caused by viral infections. Some signs and symptoms are dry, scratchy throat, sore throat, cough, swollen glands, and mild fever. Treatments are relieving symptoms, resting the voice, hydration, warm salt water gargles, over-the-counter medications such as Tylenol and ibuprofen. And this will show a visual. Some interventions are resting your voice, hydrating, humidification, throat lozenges or hard candy, and pain management. And this is the larynx. So the next one is sinusitis. It is the inflammation of mucosal lining of the sinuses caused by infection or allergies. Exudate builds up in the sinuses and puts pressure, causing pain. Some signs and symptoms are tenderness over the sinuses, purulent drainage from the nose, nasal obstruction, sometimes a non-productive cough, and the upper teeth may become painful. Some treatment options are relieving pain, promoting sinus drainage, controlling bacterial infections, and reducing inflammation and preventing recurrence. Some interventions are hot moist packs over the sinuses, inhaling moist steam to keep the mucous brains moist, sinus irrigation medications such as decongestants or vasoconstrictions to reduce swelling and to promote drainage and relieve pain. And fluid intake should be increased, rest, balanced diet, and control of allergies.
Next we have the common cold, it's called acute viral rhinitis. It's an inflammation of the nose and the upper respiratory tract. The common cold actually will come through the nasal cavities and affect sinuses, pharynx, larynx, and can possibly affect your teeth in your mouth. Signs and symptoms, you'll have a mild sore throat, you can get congested, you'll have watery eyes, sneezing, and you'll have a non-productive cough. Treatments are antihistamines, possible steroids, sprays can stabilize your mucous cell membranes, and you also want to avoid any allergens that will irritate the sinuses or the nasal cavities. Interventions that we can do is to just basically prevent a secondary bacterial infection, such as a upper respiratory infection, and you want to wash your hands and avoid contact with someone who also is sick. And then next we have pharyngitis. Pharyngitis is the inflammation of the pharynx, or what people will call is a sore throat. This normally can be caused by viruses, bacterial, and fungus. Treatments we can is basically rest, warm saline gargles, throat lozenges, antiseptic sprays, plenty of fluids, and a mild analgesic for aches and pains. Symptoms that you'll get with pharyngitis will be mild fever, headaches, and a dry, scratchy feeling in the back of the throat. Pharyngitis also will affect the tonsils in the back of your throat, which will then lead us to tonsillitis. Tonsillitis is the inflammation of the tonsils, which is caused by viruses, which normally are from the common cold or pharyngitis. Signs and symptoms are high fever, sore throat, pain in the ears, and chills. Tonsillitis is also more common in young children. Interventions that we can do are bed rest, fever management, and stick to a liquid diet. And you also want to avoid dairy products with tonsillitis and pharyngitis and laryngitis. Also, treatments that we can do, you can do an antibiotic such as penicillin for tonsillitis. And you also want to watch with tonsillitis is that it doesn't turn into strep. And that's it.